Welcome back to the Deep Dive. Today we are cutting straight to it. We're breaking down pregnancy blood tests.
And specifically how they're handled in Liverpool.
Exactly. And our main source for this, our guide, is the material from Blood Test UK. Our mission is really simple. Just pull out the key info so you know the benefits and how the whole process works locally.
Right.
So at its most basic, what is a pregnancy blood test?
It's just a quick blood draw. It looks for a special hormone, HCG.
Human chorionic gonadotropin.
That's the one. And the best part is the speed. You get results really fast, usually within 24 to 48 hours.
And this is what's so interesting, right? Because this is why it's so much better than, say, a test you buy at the chemist.
Oh, absolutely. A home test gives you a simple yes or no. But a blood test, it can find the pregnancy much sooner. We're talking as early as 6 to 8 days after conception.
Wow, that is early.
And crucially, it gives you what we call a quantitative reading.
So not just a yes or no.
Yeah.
It gives you an actual number.
Exactly. A precise number. And that number is everything. It lets doctors see how the hormone levels are progressing. If they aren't rising like they should be,
It's an immediate red flag.
it is. It gives them such a clear picture of what's happening inside. You just don't get that from a urine test.
Okay, so let's connect that to what it means for people on the ground, for expectant mothers in Liverpool.
This is where it gets really practical. I mean, we're talking about keeping the mother and baby safe. And in Liverpool, these tests are easy to get.
Where would you go?
You've got great, well-known places. There's specialized care at the Liverpool Women's Hospital and also the Royal Liverpool University Hospital. Having that local access it's a huge benefit.
And that local access feeds right into the health benefits.
Yeah.
You mentioned finding problems early. What are doctors looking for?
Well, first there's the early safety check, that HCG number we talked about. If it's abnormally low, it could signal a big problem, like an ectopic pregnancy or a risk of miscarriage.
So getting those results fast means you can act fast.
That's the key. Timely intervention can make all the difference. And second, there's what we call high-risk health.
Okay.
For pregnancies that need a bit more watching, maybe because of a health condition like gestational diabetes, these tests allow doctors to track everything very, very closely. They can manage things before they become a real issue.
And this is another key insight from our source, from Blood Test UK. The cost.
Yes, the cost advantage. This is so important.
Because these tests are mostly covered by the NHS.
Absolutely. So this isn't some private expensive thing. It means that every single expectant mother has access to this critical early care. It removes a massive barrier.
So if you're listening and you want to test, what do? The process seems pretty simple.
It is. You can just, book an appointment with your GP.
Yep.
Or even go to a walk-in clinic.
In terms of prep.
Just a small thing.
Okay.
Sometimes you might need to fast for a few hours beforehand, no food or drink. It just helps make sure other related results are accurate. And always bring your ID.
So let's sum this up. What this all means is you can get accurate, detailed results, and you can get them fast, right there in Liverpool. It gives expectant mothers a real head start.
It really does. And if you think about the bigger picture here, this early information does so much more than just confirm you're pregnant.
It sets the stage for everything else.
Right. It helps guide health choices for both mother and child that can have a positive effect for a long, long time. This isn't just a test. It's really the foundation for a healthy 9 months and beyond.
That's a really powerful way to think about it. Thank you for joining us on this deep dive. And remember, all these essential insights came directly from the guide provided by Blood Test UK. Keep asking questions and keep exploring your health options.